Hi, everyone. I'm here with Dr. Nario. Thanks for being here.
Hi, Steve. Thank you for having me again. Always a pleasure.
Okay, as you know, Dr. Nario is with Biointegrative Health Center in Reno, Nevada. You can look them up online and see all the different treatments and things that they do. So, we're going to talk about neurotherapy. And neurotherapy, we were talking before we turned this on, and this can be stacked with peptides. And it sounds like it would be really a bang for your buck. So, what is neurotherapy?
So, Steve, neurotherapy is something that, again, I want to correlate this with what we call the anti aging world, since that's where the majority of our viewers are at. And when you talk about neurotherapy, this is something that a lot of us is thinking of. It's when we talk about aging, we usually think about hormones, mitochondria, inflammation, and oxidative stress, and even stem cells. All that are true, but the one that's least discussed in aging is the autonomic nervous system. So, meaning this is the flight or flight response that we have in aging is accelerated when the autonomic nervous system is stuck in sympathetic dominance. So, when you have chronic stress, old injuries, scars, trauma, and healthy inflammation, this loop pushes the body into poor vagal tone, impaired tissue repair, and even decreased circulation, hormonal dysregulation, impaired sleep, so mitochondrial slowdown, and chronic pain and reduced mobility. So these are all hallmarks of premature aging, and neural therapy directly targets these autonomic patterns by resetting the dysfunctional circuits that maintain chronic stress signaling. So that's why, and we use procaine and we inject it in specific areas to accommodate these specific changes that I just mentioned.
Okay, so you said a bunch of big words there. So, this is a local injection,
It
right?
is? Mhm.
Into like maybe the knee area.
Right, right. So that is
And, and you said it like breaks up scar tissue and it kind of enhances the healing. Is
that
that
is
right?
right. So there are different functions of I guess neural therapy. So as I mentioned to you, it actually promotes relaxation, meaning the vagal tone, vagus nerve. We always hear about that. And also, when you're talking about tissue regeneration and blood flow, so old scar tissue, you have to remember, is something that interferes with the blockages of electrical transmission. So, by treating them, you allow better perfusion, oxygenation, nutrient delivery, and again, foundation for longevity and wound healing. Also, we have chronic inflammation. So this is something that's being lowered down by procaine, and actually, will now be a point where low-grade inflammation is going to be signaled down. And then pain reduction, I mentioned to you about areas of stiffness, limited range of motion. So this injection can definitely loosen it up and also make it accessible for faster healing. And again, yeah, there's so many different ways on how you use neural therapy, but these are the basic ones and the ones that are significant in the anti-aging world.
Okay, so if you guys have questions about this, put them in the comment section. I'll make sure the doctor gets this. Now, you also said that this can be stacked with BPC 157, TB 500, which are also healing type peptides. So tell us how that might work.
Yeah, so I mentioned to you about the functions of procaine, right? So when you mentioned about when I mentioned our neural therapy, so that's what it's more famous for, and this is something that you would probably go to your doctor and ask for in that specific term. And when you did mention about DPC 157, right, TB 500, it's called the Wolverine stack, or related to what we call the faster healing capacity of the system. So when you want faster healing, part of that healing is not only mechanical, meaning fixing muscles, ligaments, cartilage, but also electrical transmission of those specific cells that are involved in those specific actions. So procaine it's a local anesthetic actually, and in the form of zero point 0.5 to 1% is injected in those specific areas of damage, will actually fix that functional impairment rather than structural impairment. Because when you mention about the Wolverine stack, it's fixing the structure, but not fixing the function or the electrical capacity to heal and be better. And that's where procaine therapy or neurotherapy comes in, so they can work in synergy.
Okay, so the neurotherapy is actually you said fixing the function, not the physical part, but the action of healing. Am I kind of describing it right?
Right. So I want you to probably think about this as, these people get having heart attacks and they have the defibrillator, right? So it's the scar tissue is actually the impairment. So and when you have that specific impairment or entanglement, all these neural activity are just focused in one, it's not getting distributed. So what happens here is you get that defibrillator, which is the neural therapy, you're going to shock that specific area so that normal heart rhythms are achieved. I'm comparing this to heart attacks. But now, when you, after that specific procedure of electrical stabilization, now you get proper connections built up again so that the body can work better and faster. So, yes, that's kind of like a good analogy to use that with.
Okay, so we're having some technical difficulty, but I think we're getting everything you're saying. So, is there anything that you would add about maybe the benefit of this, or things that maybe you think people would ask?
Right. So when you talk about neural therapy, so neural therapy is something that in almost every patient I do, just because who is not in fight or flight, right? Everybody's just so stressed out, and who doesn't have a scar tissue? So a good example for you would be, for example, I have a patient who had a scar tissue in the back when they got operated on, and it wouldn't get fixed. The thing there is, meaning they still have the pain even after the operation. So what I did, I was injecting procaine or neural therapy in the back where the slit happened. And after like 4 or 5 weeks of doing that, the pain got better. So meaning it was not the injury that, I mean, I'm not saying that the injury didn't add to that pain, but there was some additional pain being contributed by that scar tissue now. So I want you to have a different perspective when you have a scar tissue. Scar tissue is disturbance. We need to correct those entanglements of energy flow through neural therapy or procaine therapy.
So, does this therapy help repair the scar tissue?
It breaks it down. So that's what I'm saying. It's almost like a scar buster, and you definitely want to break this. So you have to remember, I am sure you have a keloid before or a scar tissue, and it doesn't look like the normal tissue when it gets repaired, right? It's tougher, it's harder, it's not stretchable anymore. That's why if you think about the roads that are getting fixed, and if they don't put the right asphalt on that, you can't have that same feeling of smooth travel. If they use different material and it's just like gravel, it's definitely better to travel on asphalt. So what you're doing here is trying to rebuild the asphalt feel, wherein you can actually have a smooth transition when you're driving on it, rather than being on gravel. And when we're doing gravel, it's a bumpy ride. It's not comfortable, and that's why it's hard to get all these electrical transmission impulses going through there. And also at the same time, it's harder for blood flow to get to specific areas in relation to their healing process.
Okay, well, that's great information, you guys. If you have questions, comment section. So, Dr. Nario, we appreciate that input, and you're always bringing interesting insight and new things to our audience. So, thanks for being with us.
Well, Steve, thank you again. And I just wanted to make sure that everybody watches out for this, just because there's so many things that will develop from neural therapy. And as one that you just mentioned is the development of stacks. And now, as you brought that up, as I mentioned to you, that was actually a good statement that you made, that it can be stacked with peptides. And I'm also kind of thinking that can also be stacked with stem cells, exosomes, and even ozone. So we're already doing that in the clinic, and I see good results with it. But in the future, I think there will be more of an elevation to these specific protocols that you're actually mentioning. So yeah, I like your ideas. I think, and I have to give Steve credit for that one.
That's amazing. I mean, this is all the rage right now. Everybody's looking into this stuff and the things that they can stack for longevity and making themselves younger. So thank you very much, Doc.
Yeah, Steve, thank you again for having me. As we all know, that knowledge is power, and thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.